Okay, so we've got almost 30 people. So I'll just get started. Firstly, I'd like to acknowledge the traditional owners of the land on which we are meeting, and I pay my respects to the elders past and present, and the Aboriginal elders of other communities who may be here today. Good afternoon, everyone. Thank you for joining the first webinar of 2026 titled Protecting People at Risk. I'm Sabrina Idrose, a Centre for Safe Air Postdoctoral Research Fellow, and I'll be chairing today's webinar. So while air pollution affects everyone's long-term health, some groups are at higher risk. People with lung or heart conditions, older adults, children, infants, pregnant women, and people at social or economic disadvantage. These groups tend to experience the most serious health consequences from poor air quality. In this webinar, we will hear from researchers working to improve outcomes for at-risk groups. Dr. Erin Walsh, Sophie Iles, and Associate Professor Supriya Mathew. Each speaker will present for up to 15 minutes, followed by a Q&A after all presentations have ended, so please drop your questions in the Q&A section. Our first speaker is Dr. Erin Walsh, who is a Senior Research Fellow at the National Centre for Epidemiology and Population Health at the Australian National University. Her work examines how bushfire smoke affects children, young people, and vulnerable communities, and how public health messages can be better designed to meet their needs. Over to you, Erin.
Thank you very much. I'll just share my screen. And I'm hoping everybody can see my presentation.
Yep, all good. Thanks, Erin.
Excellent. So this is a talk regarding the information needs of young Australians, specifically about bushfire, which does include bushfire smoke. So it's on topic, but there'll be nuances that are a bit different from some of the other presentations today. Those of you who I had the pleasure of talking to at HEAL toward the end of last year will be familiar with some of the broad strokes in this project, but I'll do a brief reminder and also an overview for people who weren't present. So the motivation for this work is that when it comes to the Black Summer bushfires, one of the greatest smoke events that's happened in Australia in living memory, a lot of the messaging and thoughts and information focused on vulnerable groups such as people living in leaky housing, adults, and small children. Something that was really missing from that was thinking about an age group that's often overlooked, and that is young adults, 15 to 19. The reason this age group is distinct when it comes to public health messaging and vulnerability is they're not really children, but they're also not really adults. They still have many of the physiological vulnerabilities associated with youth, but they lack the agency to do things like they can't just go out and buy an air purifier because they mightn't have the means to, or own the home in which the air purifier would go. They can't just hop in a car and drive away because they may not own one or be able to have a license at that point. So it's a transitional phase, which is definitely overlooked in a lot of discourse around disasters, air safety, and bushfire. Yet we have a lot of people in this age group. So over 27,000 young people were directly impacted by that one bushfire event. Just to make the point that this is an underserved group, we undertook a systematic review looking at the health, well-being, health and well-being impacts of bushfire smoke and bushfire more broadly on people in this age group. Of almost 3,000 records, we found 4 papers that were about people aged 15 to 19. That is tiny when you think about it. So then where do these people go to find out more? There's feedback. Hopefully, is this any better for the audience?
The audio is fine for me.
Okay.
Yeah.
I'll continue then. So if a young person in this age group wants to learn about what they can do to protect themselves and others from the impacts of bushfire and bushfire smoke, where are they likely to go? Often they're likely to go to TikTok, to YouTube Shorts, and multimedia online content. So we undertook an AI media review of all of these sources of information that young people are most likely to consult. And what we found is there were a lot of memes, there was a lot of really emotional footage of fire, but there wasn't actually much actionable advice. Information was sparse. We then conducted an online survey to ask people, well, young people in this age group, if you are to learn about how to protect yourself and others from bushfire and bushfire smoke, how would you like to learn about it? And a big thing that came from that is they didn't just want to be lectured. They didn't want checklists. They wanted things that were engaging and informative at the same time. So then we ran a series of focus groups regarding the information needs. Okay, well, we kind of know how you want information to be conveyed to you. What information is actually relevant to a person in this age group? And a big theme there is, what is something that a young person who might have limited agency can still do to perhaps positively influence others and other people's behaviour, but also to look after themselves? So what we decided to do with all of this information was to develop a comic. The idea is to start with a narrative that is compelling and hopefully enjoyable for young people to read, and then cram as much actual information that they need as possible into that. So this began with characters. We learnt from our young people that they like to see themselves in the information and media that they consume, rather than just seeing one person robotically going through the motions. So we developed a cast of characters and refined these with a working group of young people. This then got translated into a script. The script was a mix of information needs being met, but also actual lived experience of people in this age group during the Black Summer bushfires. No individual person's story was told literally, but we took threads from our young people. For example, the experience of having a home directly threatened by fire is one clear through line that was needed, but also the experience of having smoke just around for a very long time and how that impacts even very urban, safe life. The next thing we needed to do is establish a visual style. This was tricky, but eventually we came upon an aesthetic that was not colourful, that had 3D design backgrounds, but was visually clear when viewed on a smartphone. And this all culminated in a draft script. So we ended up with a cast of characters who spanned different young people's lived experience, and each character embodied a different archetype of how to look after oneself. Len very much focused on the psychological protection. Yeet Nuo's storyline was very much about learning to deal with bushfire smoke. She was important because she is an international student who'd never encountered bushfire before. So her narrative allowed us to essentially, without sounding patronizing, have information conveyed about stuffing, about helping to seal your house, about staying indoors, about how the smoke haze shouldn't be treated as something that's immediately terrifying to be exposed to, but you probably shouldn't stay in it for too long, and so on for the other characters. At the time of producing this talk, we have one full prototype draft that is still being refined. This is the entirety of the comic in preview format. One thing that you'll note is the aspect ratio. This follows what's called the manhua format, where it's intended to be read on a smartphone with each frame you essentially scroll through. Through some pilot testing with other visual formats, young people tended to prefer this. It will also allow us to have short, essentially slideshows on TikTok and other places where young people will go where they can view it. I'm going to share with you some examples of content from this. You'll note that things are still a little bit sketchy. That's because this isn't the final version. There are many iterations. So to give you an example of an approach that we've taken for showing through narrative, a positive example of an action that a young person can do in a disaster scenario that is within their reach and is genuinely helpful and is positively reinforced by the people around them. We've got a short sequence of Stevie, a young person whose home is just being threatened by the bushfire. We've changed the visual style from just monochrome to a very smoky red. We learnt from the young people they didn't want to see depictions of haze that was like grey and colourless, because something that struck them emotionally was the colour of the smoke during the bushfire event. So here we see Stevie and her family loading up their car. Through dialogue, we established that there's important documents in the box that the father's loading into the car. And Stevie asks the question, including house insurance stuff? Yep. And the father praises Stevie for her help with a checklist. And of course, she feels a bit awkward about that. The intent of this sequence is there's the drama of the smoke is coming in, but there is also a direct modeling of a behavior that we want young people to have. I'll provide one more example. So one big thing that we found in our research, particularly with the focus groups, was there's a complete lack that young people find in counselling after an event is completed. They often felt, particularly when it came to the persistent bushfire smoke, there were many who didn't find the smoke itself distressing, particularly the older people in our age group, but they found that just they were expected to go back to life as normal, as if nothing had changed. Their schooling had been disrupted, their environment had been changed, and even though things appeared to be back to normal, they wanted more discourse and to be seen about the recovery from that. So this sequence both models positive behaviours in terms of bushfire management, but tries to focus on the things going back to usual. So we have two characters attending a ultimate frisbee game. It's just a setting which is intended to be, they're outside, it's wide open spaces. And I'll just briefly read the dialogue before I move on. So, what are you up to after the game? I'm heading out to the reserve. How's it going out there? Still lots to do? Yeah, I'm working on through reducing the leaf litter. And you do that for fun. It's meditative. You could come and lend a hand. Are the snakes and spiders and creepy crawlies all back? Not all, but some. It's great. Ugh. I'm heartbroken to turn down your kind invitation, but I will be needed elsewhere. Figures, the snakes will be very upset that you snubbed them. Respectfully, stay mad, snakes. So in this short sequence, we've actually included multiple actions in terms of Len is showing what you can do to protect your community from future bushfires, and he's trying to share that with his friend and bring more people into the positive behaviours. So from this draft, I'm going to wrap up pretty quick. I can see I'm nearly at time. From this draft, we shared this with an online survey of 350 people aged between 15 and 19, and it was nationally representative in terms of we made sure that we had a good number of people from each state and territory. A bias that I think a lot of us will notice in this kind of literature is Victoria tends to be very overrepresented because it's often the site of some of the worst fire events. But young people in Victoria might have a different experience from elsewhere, so we wanted to cover everybody. In terms of, we asked people to read the comic and then say what they learnt from it or what the information they could see was in it. And the three themes are exactly what we hoped that they would pick up on, and that is that preparation and practical safety actions are essential. Bushfire can cause strong emotions and have an impact on mental health, particularly for young people. And that communication, community, and support really makes a difference. A big through line throughout the comic that we learnt from our young person focus group is that friends and family are key in how people react. That said, it's not for everyone. Some of the participants really liked it. They said bushfires can be scary, but the comic showed them ways to be safe and prepared. But there were a few who said, I don't know, it was really long and a lot of the story was unnecessary, so I got bored before I could learn much. So very much like any communication, I think it's important to remember that you can make the most perfect piece of communication known to mankind for what seems like a really specific group of people, but there's no such thing as a general public or a general group of people. There's always going to be nuance and preference. So what's next? We're starting to refine the comic for its final iteration on the basis of workshop feedback, online feedback, and from a bunch of really helpful stakeholders. An example here is in the prior iteration of the comic, we just highlighted the fact that AM radios exist. And we discovered that a lot of young people don't know that there's different frequencies that you have to tune it to. And indeed, a lot of people don't realise that the emergency frequency differs depending on where you are. So we've essentially updated that to include that further information. I'm really interested in hearing people's thoughts and questions regarding air safety in particular, because right now we've focused very much on staying inside and sealing windows as much as possible, but there might be other messages that people attending this webinar think need to be included. So we're always up for more information, at least until we draw the final one. So thank you very much for your attention. I'd like to acknowledge the Peter Brabazon Brook Bushfire Research Fund. Would not have been possible without that funding to support this work. And we have a very long list of excellent humans who have really helped us out with this. So thank you very much.
Thank you so much, Erin, for providing great insights into the information needs of young Australians. There's a question in the chat, but we'll get to it after all presentations have ended. Then our next speaker is Sophie Iles. Sophie is a research assistant with the Children's Health and Environment Program at the University of Queensland, supporting the environmental measures of bushfire smoke exposure and respiratory health and birth study. Her work involves partnering with children, families, and firefighters to better understand the health effects of bushfire smoke exposure. Over to you, Sophie.
Awesome. Thanks, Sabrina. I'll just share my screen. Oh, is that all good?
We can see your presenter's view, so maybe swap this, please.
Yep, no worries.
Yep, all good.
That's good. Perfect. Awesome. So this study is about co-designing effective health protective strategies for wildland firefighters. So a bit of background. So we know that firefighters are a highly exposed group with both repeated and extremely high levels of exposure. And we know that there are short and long-term health impacts of occupational bushfire smoke exposure. These have been well established. We know that workplaces implement mandatory PPE to minimize exposure and injury. However, there are often quite a lot of barriers, especially in the field for our wildland firefighters, to effective PPE use. So just the very basic sciencey stuff. This study centers around the health belief model, and just a very brief overview. This kind of describes how various factors can influence an individual's decision to implement any type of health protective behavior. So in our case, it's often PPE, but there are also a lot of at-home things that you can do to protect your health, whether it's staying fit and healthy, eating good food, anything along those lines. And essentially, the likelihood that anyone's going to implement a behavior is made up of the perceived threat and evaluation of that behavior, as well as can be influenced by an individual's self-efficacy and individual cues to action, such as personal events and stories, things like that. So we aim to assess the current knowledge of firefighters and their current health protective behaviours, and further to understand the barriers to those health protective behaviours and evaluate potential future solutions and research options. So we did semi-structured in-depth interviews with wildland firefighters who work for a local government organisation in southeast Queensland, and we identified these guys through fieldwork in our existing Ember Health study. So we did a lot of open-ended questions that were structured around the health belief model. We transcribed, de-identified, so all of the data you'll see here, everyone has an alias involved. And then we identified common themes across all of our participants. So we had 10 fireys from the local government organisation and 40% were female. We had a really nice age range of 27 to 60 years and a really good experience variation from 2 months on the job to 30 years on the job. And within that, we had a lot of variation on levels of seniority as well. So crew members, crew leaders, and then our senior firefighters. We ended up also interviewing one independent land management consultant. I'll discuss his results slightly separately, but essentially we came to this particular person because one of our lead firefighters actually suggested that this individual would have a very different view on health protection, and this is true. So I'll discuss him later. So for the knowledge of health effects across our fire team, we kind of had two major themes emerge when talking about their current knowledge. So firstly, it was really clear that the short-term health knowledge is predominantly based around their personal experiences on working on the fire ground. So participants reported symptoms such as brain fog, fatigue, muscle soreness, respiratory issues. Amy sums it up pretty nicely, talking about how coming off a fire field is like having a really bad hangover. And secondly, it kind of appears that our firefighters are able to identify hazards of their job, so such as bushfire smoke exposure, but they weren't exactly sure what the potential long-term health effects might be from the exposure to these hazards. So Finn can identify smoke inhalation, for example. However, when we asked him what kind of health effects do you think that might have, he said, I don't really know at this stage, maybe ask me in another 10 years or something like that. So now talking about what our fireys currently do to protect themselves. So we kind of had two groups here as well. So firstly, our work mandated things. So mandatory PPE included fire retardant uniforms, fire boots, helmets and gloves, and adherence to this was really high across the group, which was great to see. Respiratory protection or RPE and eye protection was never worn all of the time by any firefighter. And in fact, physical removal, so instead of putting on a mask, they would essentially just step away from the smoke. That was preferred by 80% of our participants. And then we had the things that were more of a personal preference, so they weren't mandated by work policy at all. And that was their at-home gear washing and hygiene habits from 80% of our participants, regular exercise from 70%, and good nutrition from 60%. For our current motivators of our fireys, they kind of fell into 5 categories. Most strongly, everyone interviewed was able to recount at least one personal event or story, which was a really strong motivator for PPE use in particular. There was a similar story which was really moving across most of the group about a colleague that was injured, and that was a really, really strong motivator for these guys for that immediate injury protection. Secondly, we had short-term injury. So that kind of relates to wearing those mandated PPE. And other motivators included the long-term health protection, as well as protection of loved ones and pets. And then finally, which was really positive to see, was our fireys have a really positive work culture around PPE. This idea of a zero harm policy was talked about tremendously, which is a really nice idea that came through. Previously, we see a lot of firefighter health research talking about this badge of honor mentality, where fireys will often want dirty uniforms and to be perceived as being really experienced. But this organisation in particular places a lot of value on effective PPE use and health protection in that sense, which is really awesome. Moving on to the barriers that our firefighters face. So for respiratory protection, everyone described current RPE options as uncomfortable. They were also described as inconvenient, restrictive, or having an improper seal or fit, which is quite concerning. Our fireys are not mask tested either, so they're generally just using like a P2 mask. For general PPE, 3 out of 4 women expressed issues with the PPE fit, and helmets were mentioned as uncomfortable, however, were worn very consistently, and that is quite strongly related to that immediate injury protection. And then facilities access. So our guys are not provided with any laundering services, so they have to do all of their gear washing at home. They also don't have any practical access to gyms. So although their organisation does have some gyms available, our team are mostly field-based and they're not office-based, and they have to often drive outside of work time if they wanted to access these facilities, which is just not very feasible in their own lives. So what do firefighters want in future, and what's going to motivate them to adopt better health protective strategies? Greg sums it up really nicely, and this was kind of the common thing that came out, but being more informed would be really helpful. Some specifics they want are more short and long-term health information, better PPE options, particularly respiratory protective equipment. They want greater exposure information. They want to know what chemicals they're exposed to. Particularly, they're concerned about particular types of weeds and plants and unknown burning conditions. They want more access to work-provided services, such as those gear washing opportunities at work, as well as the other options to protect their health, so at-home things. So whether it be diet changes, any supplements, anything like that. Now, as promised, health protection through a different lens, and this was our independent fire consultant, and we'll call him Carl here. So Carl is an independent land management consultant with over 50 years experience. He spans lots of different industries, all related to fire, but across many organisations. He has a really extensive track record of working with traditional owners, and really brought this unique perspective that cultural burning practices can be used as an effective health protective strategy. So he discussed that an in-depth knowledge of the land being burned is really critical to reducing exposure, and implementing cultural burning practices with potentially more frequent burning, lower intensity burning may reduce the need for PPE. So then the co-design process. So the interviews kind of formed the basis of our knowledge, and then we hosted a co-design workshop for the 11 fireys that we interviewed, as well as some management of the organisation that our fireys are a part of, workplace health and safety officers, as well as extended the invitation to a wider fire community, so some other organisations as well. So we had about 30 participants in this workshop, and it was a whole day workshop hosted at UQ. And the idea of this was to really prioritise those potential research ideas for future projects. So what did we do in the workshop? So we had Dr. Tari Forrester-Bowling from Deakin University come and facilitate with our team for the day. And we did these 4 main activities. So firstly, we did some interview validation. And this was really important because we did include the groups from outside of our interview focus groups. So we were able to kind of narrow down if these barriers are universal or if they're organisation specific. And essentially we printed out some A3 paper with statements from the interviews or themes from the interviews, and participants had like a strongly agree, strongly disagree slider, and they could mark where they felt they personally viewed that thing and then write a little comment about it. And then the next activity we did was some journey mapping. Participants would kind of write some things down that happened in the day, some key events, and then draw any high and low points. And then these were kind of identifying moments that matter. And these represent either really good things that are happening. And in this way, we can look at these things and hopefully apply them to some things that aren't working as well for them. And then those low points of the day are key targets for interventions and things like that. Thirdly, participants had to brainstorm some action ideas, and these really ranged from really simple things that people could do to some very large scale, very expensive ideas that came up. We didn't really care at this point what the ideas were, just generating as many as possible. And then finally, participants voted on everyone's action ideas, and we plotted them on this feasibility and impact matrix. So essentially the ideas that we want to prioritise in research have the high feasibility and high impact. So that's how we ended the day there. And so some very broad co-design priorities here. Essentially, people wanted best practice decontamination, and this kind of extended on the interviews from being gear washing to also just personal decontamination, as well as vehicle decontamination as well, because often fireys will hop in their own car after a shift at work in their dirty gear, go home, and then that car is then contaminated. Secondly, respiratory protection and PPE usability, potentially looking at different options for that. Health impacts of repeated exposure, systems for knowledge sharing, cultural burning and fuel reduction, and then workplace support and well-being. So these were the main priorities that came out of this session. And the next step in this process is to continue the co-design and search for funding opportunities to investigate these ideas. We really strive to work with the fireys and are fully guided by their wants and needs. They're an amazing team to work with. And this project has been a super important first step in enhancing the health protection of the people whose job it is to protect us. So a super important area. Thank you so much for listening.
Thank you so much, Sophie, for showcasing your amazing work on improving firefighter health protective strategies. So the last speaker is Supriya Mathew, who is an associate professor at the Remote Health Systems and Climate Change Center at the Menzies School of Health Research. She is based in Alice Springs and focuses on the health impacts of climate change on remote communities. Over to you, Supriya.
Thanks, Sabrina. Just quickly checking that you can hear me and the slides are okay.
Yeah, all good. Thanks, Supriya.
Thank you so much. Hi, everyone, and thanks so much for this opportunity to present our research. I'm today presenting from Mbandwa, Alice Springs. I would like to quickly acknowledge the Aranda land from which I'm presenting, and also pay my respect to Aranda elders, past, present, and emerging. So every opportunity we get to present, we try and introduce our research team, basically because the whole research team is based in remote Australia. We are all part of the Remote Health Systems and Climate Change Center. The center is based in Alice Springs. Our research is focused on understanding the impact of climate change on remote populations. We also specifically focus on the health of First Nations populations. For today's presentation, which is actually the work of the team I just introduced, I would like to focus on particulate matter monitoring in remote Australia. So in general, when we talk about remote Australia, there is the preconceived notion is that air quality is quite good. Which is correct to a great extent. And this notion might be because we have less industries, there's less cars on the road, population sizes are quite small. And initially, when we were trying to start our research, one of the hurdles that we faced was convincing local stakeholders that we may need to monitor air quality. I think from that point to now, we have progressed. There's more understanding in terms of the impacts of air quality. There's more understanding in terms of invisible air quality issues in remote Australia. And today, as I focus only on particulate matter, just in case there is someone not familiar with the term, particulate matter are tiny invisible particles, usually have a diameter less than 10 micrometer. To understand the sizing, hair has a thickness of 50 to 70 micrometers, so it's very, very small and we can't see it directly. In remote Australia, there are several sources for particulate matter. One key source is the dust itself, particularly from where I'm presenting. We have a desert climate. There's always wind. Desert dust becomes a source of particulate matter. Bushfires, pollen, poorly maintained cars, which is quite characteristic in very remote communities. Diesel generators in very remote communities. There are several remote communities in Australia where we still rely on diesel power generators rather than solar or natural gas. We also have evidence from the Australian Institute of Health and Welfare that 1.4% of the total disease burden among First Nations people could be attributed to particulate matter exposure. We all know that health outcomes are poorer with increasing remoteness, partially because of limited access to health services, but also because a lot of the populations living in remote Australia have poor health conditions. So if we do not focus on remote Australia and we don't focus on air quality impacts, if we do not conduct specific studies in remote Australia, what we will be missing is actually groups of people who are probably the most vulnerable in Australia, who lack protected infrastructure. In some of the very remote communities, housing infrastructure is extremely poor. And as I mentioned before, a lot of the population have pre-existing conditions, high rates of respiratory disease, cardiovascular disease. So this makes it really important to conduct or focus research in remote communities of Australia. But if we look at current status, this is just a classic example of how we sometimes look at the impacts of air pollution. Like during the 2023 Barkly Complex bushfires, there was a lot of media coverage. There was reports written about it, but majority of the focus was on how much land was burned and how much cattle was killed, with very limited focus on health. And while this is important, till now we haven't seen any follow-up studies on what actually happened to the people who lived in the Barkly region during that bushfire event. So there is a lack of focus on health to a great extent, not always, but in many cases there are lack of focus on health. If we look at data availability, these two maps we can see side by side. If you just look at inland Australia, which is categorized as predominantly remote or very remote, according to the ABS, we can see that there is very limited number of air quality monitoring stations. And when I say air quality monitoring stations, these are scientific grade air quality monitoring stations that are actually monitored by environmental protection agencies. So what we have in remote Australia at the moment is a lack of ground-based air quality data. There isn't enough studies that actually looked at the impact of air pollution or particulate matter exposure on health. Our research, the team's research, is actually focused on this gap, and we received funding from Department of Business's Citizen Science Grant, and we had a project called Erin Walsh. We also received funding from the Medical Research Future Fund for a project called Air in East Arnhem. So the projects were conducted at Alice Springs, and the Air in East Arnhem project was conducted in the East Arnhem region. So we've used a slightly different approach, given we know that it's not feasible to actually use scientific grade data collection in remote locations, or probably EPA cannot cover whole of Australia. So what we have done is, the approach we have used is we've collected lived experiences of air pollution, work experiences of air pollution from these two sites. We have also offered a citizen science approach where people can actually borrow wearable sensors and collect air quality, temperature, a number of weather and air quality parameters, actually. We also installed a number of low-cost sensors across these two regions, and we were able to partner with the Aerator app team. This app is developed by University of Tasmania, led by Faye Johnston, Amanda Wheeler, Grant Williamson. So we collaborated with the Aerator app team to make sure that whatever data we are collecting through the low-cost sensors is available in real time to local residents. So I might just focus a little bit on the fixed low-cost monitoring that we installed in the two sites. So it's a little bit challenging in remote Australia. It's not as straightforward. We quickly did realize that scientific grade monitoring wouldn't be feasible. We did take some quotes. We involved the NTEP as well. But what happened is the figures they quoted, we could have afforded the capital cost, but there were annual maintenance costs which didn't, was not in line with our funding timelines. So that is something that we realized when we started itself. One of the challenges we have faced is safety issues. When we install sensors, sometimes, kids play around, they kick a football and it just falls on the sensor. Sometimes it gets damaged. So there's usually some additional costs that come through that we don't expect. One of the challenges for us was validating the low-cost sensors against scientific grade instruments. For us, if we are in Alice Springs, the closest EPA monitoring station is 1,000 kilometers away, which is in Catherine. And even Catherine is in a tropical climate. So if we are trying to validate the instrument against a tropical climate, probably that's also maybe not good enough. So we don't have that option like urban sites like Sydney, Melbourne, or Perth may have in terms of co-locating a sensor and validating the results. We had huge data gaps. Internet instability was an issue. We had staff turnover issues, which is very common in remote Australia. We have to constantly orient people saying that please don't turn off that switch. If we turn off that switch, our data will stop. So these were some of the challenges. Another key challenge was handing over the sensors after the project period, because we really wanted the data to continue even after the research funding periods. We got around that by partnering with some of the local health services. For instance, in Alice Springs, the town council came on board and they were happy to look after sensors beyond the project. period. In East Arnhem, the local health service was quite interested, so they have agreed to take over the census. Now, just I'll give a brief overview of what we found through the monitoring we did for Alice Springs and Nhulunbuy in East Arnhem. So, as I mentioned earlier, the preconceived notion is that air quality is good. And yes, the air quality is good compared to many other urban sites. If we compare our data against the daily limits set by regulatory boards, WHO or the national ones, it's always or mostly within the regulatory standards. But what we found is that there are hourly peaks. For instance, there have been instances of bushfire events in Alice Springs where suddenly particulate matter just goes up to 240 or 250 and stays like that for like maybe a couple of hours. But it gets dissipated very quickly because of the wind. So what happens is that if we just look at it, yes, air quality is good. But if someone is outside during that 3-hour period, obviously they will get affected, and which is the case for many First Nations people who spend a lot of time in an outdoor environment. Similarly, for tropical remote Australia, we found way more exceedances than the Alice Springs site, basically because there's more bushfires in the tropical region. But the same issue overall, if you look at it, you feel like the air quality is good, but there's still several hourly peaks that might be really harmful for health. We also talked to local residents. We collected both lived experience and work experiences. Majority of the people didn't, particularly First Nations participants, didn't link air quality issues to particulate matter. But discussions were around just smoke, bushfires, and dust. Most participants agreed that it affects them health-wise. Participants also mentioned that they had observed that some of these dust events, particularly in Alice Springs, they were getting more worse compared to the past. People shared that some participants shared that they had the option to implement some protective measures, like stay in an indoor environment or close all the doors. But most participants were worried about either their family members or people living in very remote communities where housing infrastructure was completely inadequate. So just through this presentation, what I wanted to convey is that though what we found is that according to the regulatory standards, air quality or particulate matters within the air quality standards, but it's still a health risk for remote community members, particularly because we often see these hourly peaks, which are like it just spikes sometimes to values which are quite harmful. Another point I want to make is we, as remote residents, most people understand that we probably may not be able to install, scientific grade, good air quality monitors across Australia. But what people normally appreciate is the ability to have data and the ability to know. So as residents of Australia, no matter which location we all belong to, we all have a right to know what air we are breathing and what our air quality is. I might just wrap up there and take further questions. Thanks so much.
Thank you so much, Supriya, for sharing your wonderful work in Alice Springs and remote communities. So now we'll open the floor for any questions that the attendees may have. I think we'll start with Erin. There's a question from Michelle. Michelle's asking, how are you navigating young people's access to this resource with the social media ban on under 16-year-olds? Are you providing this resource to schools in physical form also?
Mm-hmm. That's an excellent question. Originally, when we started this, the social media ban wasn't in place, so it's become a consideration during the development. Essentially, it is absolutely going to restrict the reach for the younger end of our age band, for Instagram and TikTok. However, there are other platforms such as YouTube Shorts, and they're essentially coming into the fore as young people being banned from their other areas, which we're hoping to expand into. We are definitely planning to distribute digital versions of this to a number of stakeholders, hoping to reach out to schools. We've got quite a long list of volunteer firefighting organisations, youth advocacy organisations like the Youth Coalition of the ACT. We are working in the art at a resolution that can be printed. We don't currently have the budget for that, but if upon project completion we're able to secure that, then physical distribution would absolutely be part of the plan, particularly in places like waiting rooms where there might be young people waiting to go to see the doctor or something, not much else to do, may as well flick through, enjoy the story and learn something. But certainly for now, our distribution plans are still focused on the same social media platforms, hoping that we'll get the 17, 18 and 19-year-old slice of the cohort, and also possibly target parents and carers who might want to share it with their children as well.
Thanks, Erin. And for Sophie, Misha was wondering if you interviewed any Indigenous firefighters for your work. She's interested to know how their experience and knowledge may differ from others and benefits of knowledge, wisdom, and gained, etc.
Yeah, definitely. So in this cohort, no one was an Indigenous. As I said, the original 10 were just from the one organisation, and that was our focus because we already work with them in our EMBA study. And then Carl came along out of recommendation from one of those firefighters. Carl himself is not Indigenous, but has been working with Indigenous traditional owners for a very, very long time. And he is invited out to do cultural burns with them. So although his perspective is not from being Indigenous himself, he has worked quite closely with them. We spoke to him and saw that conversation as a very, very strong opportunity to hopefully connect with traditional owners in future and kind of extend this research into that community. What came across in the workshop was that everyone was really keen to learn more about that, learn more about the benefits and that knowledge, because there is so much vast knowledge in our traditional owners. They've been burning the land for 60,000 years. And so tapping into their knowledge is definitely something that we want to do in future. And we're really hoping that Carl can connect us with the right people, and we'd love to extend in that direction in future.
Thanks, Sophie. And the next question goes to Supriya. Someone has said that the indoor air quality is likely to add to First Nations people's air quality health burden. Do you have any plans to look at indoor air quality issues?
Yeah, so in the citizen science part of our study, what we asked participants to do is to collect air quality wherever people felt might not be great. So in that way, people have actually measured air quality in the indoor environments, but we haven't specifically focused on indoor air quality. But through the citizen science data collection, we have been able to access some data.
Thanks, Supriya. And there's a question from Sharon to Erin. Sharon was wondering what were the young people's attitude or compliance for wearing face masks?
Excellent question. So very much like a lot of people who did research on this topic just around when COVID hit, there was quite some conflation in our young people's minds about masks for bushfire smoke versus masks for COVID. At the time we conducted a number of the workshops, mask wearing had become ubiquitous and normalised because of COVID, and there was very little direct reflection on mask wearing in the context of air safety. However, something that did come through that was quite interesting was often the young people experienced being stuck at home for many, many days on end. They didn't go outside in circumstances where mask wearing might be required. Their parents were the ones who went out. When schools closed, they were the ones who went out. So their emphasis was a bit less on forms of protecting themselves when they're out and about, and much more on being stuck at home and the psychological impacts of that. And they were very hungry for information about how to make their homes safer.
Thanks, Erin. Next question goes to Sophie. Someone is asking whether you are aware of research in Australia or elsewhere to improve RPE comfort. Is the National Institute for Occupational Safety and Health in USA still active?
Yeah, so I was fortunate enough to attend the AFAC conference at the end of last year in Perth, and that's the Australian and New Zealand Conference for Emergency Service Workers. And there was a lot of discussion there around how to improve both RPE and just general PPE comfort, particularly for women. So there was a big group there, and they were the Women in Firefighting Australia, I think they're called. And there was a lot of research there. And one group in particular, who, forgive me, I cannot recall who it was off the top of my head, but had actually imported fire gear from the US that they use, and had been testing that and surveying that in a group of firefighters. I believe it was in Melbourne, and they had some really promising results there. So I think part of this direction is looking for other places to get different PPE from. We are actually doing a mask trial at the moment with a couple of our firefighters. We have obtained this positive pressure mask. It's very fancy, looks very cool. But we're essentially doing a randomized trial between just their normal mask wearing and this positive pressure mask. And if that is something that is seen to be effective, hopefully we can get some funding to investigate that further as well.
Thanks, Sophie. So this is a question for Supriya. Michael has mentioned that models have been developed to predict PM 2.5 concentrations utilizing remote sensing or satellite data. Have you considered validating these models against your ground level measurements in remote areas?
Yes, so the postdoc leading that part of the work is actually starting to do that. Ideally, it would be good to have both, because, we can even satellite derived PM 2.5, we could validate that as well. But now, since we don't have that option, we will be using that. Yep, we are on it.
Thanks, Supriya. Last question for Sophie. Michelle was wondering if you know what are the workers' compensation rates and downtime for the firefighters due to inadequate and ill-fitting PPE. Because as you know, there are physical and mental impacts on the suitability of what they are required to wear.
Yeah, so I can't talk to the compensation rates, but they have mandated 10-hour breaks at the moment between shifts. So that's all I'm aware of from these guys. I will just say as well that the group that we work with are not the red truck fireys. So they're not like the first responder 000 firefighters, and they're also not rural firefighters who that's their sole job. So these guys are often seconded, so they work in other parts of their organization in just general land management. Some work in offices, and this is they do the planned burning, the hazard reduction burning. So they're quite an underserved group for multiple reasons, but that being the main one, that fire is not their sole role. So that's why they're such an interesting group to work with.
Thanks, Sophie. And then there's a last question for Supriya. I'm not sure if you're able to comment on this, but someone has mentioned that do you know how air is considered as part of country for First Nations communities? Acknowledgements of country often refer to land and waters, but not air. Do you think we should include air?
Yeah, so I don't think I'm qualified to answer should we include air in the acknowledgement of country. So I won't comment on that. But in our research, what we observed was when we tried to bring air in, it didn't really work. We had to refer to bushfires test. There was no separation between air and land and country. That's our observation. And all of our data collection was led by a First Nations researcher. So she actually had a poster where she drew sun, clouds, land, water, everything. And it is through those discussion process that air pollution was actually presented. It was not straight about air pollution. So from research perspective, it was not directly air. It was actually various symbols that were important for First Nations people that we used. Acknowledgement of country, I'm not sure, but good question.
Thanks, Supriya. So I don't believe there are any more questions left. But as we conclude today's webinar, I'd like to extend my sincere appreciation to Erin, Sophie, and Supriya for sharing their time and insights on this topic. And we hope our attendees have found the discussion valuable and informative. If you have any further questions or would like additional resources, please don't hesitate to reach out to the Centre for Safe Air. We look forward to seeing you at our next webinar. Thank you and have a great weekend, everyone. Bye.